So my name again, Bill Hammett. Here's my contact information. It's on the screen. Also available to you is Rhiannon, is our account manager, and Anna is the benefits administrator. All three of us can help you with really anything that you need, and we can kind of filter it within our office as to who should take the task. But reach out to any of us, not just now, but throughout the year. During this open enrollment process, I could be very helpful in helping you understand which plans to choose. If you need some help deciding between the different plans, please feel free to reach out to me throughout the year. If you have questions on claims, if you need some help with finding doctors, whatever it may be, we're here for you all year long. So the agenda is going to hit on the things you think. We'll talk about timelines, medical, dental, vision, disability, life, FSAs. We're going to go through our enrollment portal real quick. And then, of course, we're going to talk questions at any point. So open enrollment starts today, starts right now. All of you should have just received an email inviting you to log in and enroll pick our plans, enroll in what you want. Remember, this is your time to enroll, waive, add a dependent, remove a dependent. If you do not join the plan now, and if you waive coverage, you generally have to wait until next year to join at this time. However, there are a number of qualifying events such as losing coverage elsewhere, and you can join the plan, or if you turn 26 or whatever it may be. So this is a big time of the year for you to enroll. Any changes you make would go into effect February 1st. We're asking that everybody have this done no later than 7 days from today, and you will complete your applications at the Ease Enrollment portal, which again, you should have just received information on. So this year, as we do every year, Katrina and I get together and we look at all the different plans and all the different options, and we decide what is the best path forward. We got a 15% increase out of Aetna this year, which is quite sizable. And so we went shopping, and we're going to be rolling out, instead of the Aetna policy, a company called Cigna Plus Oscar, which we'll talk a little bit more about. And we still have the same Kaiser Gold and Platinum plans. And then with Cigna Plus Oscar, we've got the Silver, Gold, and Platinum PPO plans. So let's talk about our Kaiser plans real quick. Not a lot of changes here, but I did want to point out our HMO versus the HMO Gold versus the HMO Platinum plans. Both of them have very low deductibles. And just so we're clear, deductible is generally speaking what the insurance company says. You must pay all of this number before we start to pay any portion. And so $250 is not a very high deductible, but it does come into play in certain scenarios. The out-of-pocket maximum, this is the most that you would ever be asked to pay in a calendar year. So if I'm on this gold plan right here and I have $1 million in claims, once I've paid out of my pocket collectively for everything you're looking at, every benefit covered, every copay, all of it, once I've paid out of my pocket $7,800, then I pay nothing else for the rest of the calendar year, and Kaiser pays 100% of everything for covered services from Kaiser doctors. All right. So this maximum out-of-pocket number is one of the most important numbers, and frankly, a big chunk of what you're paying for in your premium is this deal you're making with your insurance company that says, at this particular place, I pay nothing else and you pay 100%. Okay, so that's what an out-of-pocket maximum would be. The second number for family, this only comes into play if you are enrolled plus another person in your family. If you enrolled by yourself, it would not come into play at all. But if it is you and a spouse, or you and a child, or you and a spouse and children, what this means, and you'll see the term embedded means that no one person in the family unit pays any more than their individual maximum deductible or individual out-of-pocket maximum. So if it's me, my wife, and 3 kids on this plan, I have the $1 million problem. I will have met my deductible in full at $250, and I will have met my out-of-pocket maximum in full at $7,800. I will pay for nothing else for the rest of the year, and my family has the other $250 deductible and the other $7,800 out of pocket. All right. So the family out-of-pocket max is the most an entire family could pay. The individual max would still apply within the family unit. So no one person in the family pays any more than their individual maximum. You'll notice right off the bat, the platinum level plans, the biggest difference platinum level plans have above the other plans is the maximum out of pocket is much lower. So for this platinum plan, it's $3,300 lower out of pocket maximum. As we move down the page here a little bit, we see copays for doctor visits, lab, x-ray. The first number is going to be your primary care doctor visit. The second is specialist. Down here at diagnostic, lab, and x-ray, the lab blood work, that cost is $35, x-rays are $55, deductible waived. So you do not need to meet this $250 deductible before getting these copays. You get them right away. However, complex imaging such as CAT scans, PET scans, MRIs, you would pay your deductible first, and then you'd pay your $250 copay. So these deductibles are annual. You do not do them every single time there's an event. It's not like car insurance where every time you have an accident, you pay the deductible in full. These are annual deductibles. So if you had met your $250 deductible already from some other situation, then that MRI would just be $250. As we kind of scroll down, we see that there's no chiropractic covered on these plans. We have copays for prescription drugs. And then down here at the bottom, hospital stay, surgery, emergency room. This $600 per day, maximum of 5 days. This does not mean that they throw you out of the hospital on day 6 and wish you good luck. This just means that you pay the $600 copay day 1, 2, 3, 4, 5. If you're there for 7, 10, 15 days straight, you'll no longer pay that copay. All right, so that is just basically the room and board for that hospital stay. Surgery is a flat dollar copay. Emergency room is a flat dollar copay. And then, of course, the platinum plans, you see all the copays, all the numbers are lower. And the platinum level plans are a good buy for those of you that are accessing healthcare quite a bit. You are using your health plan a lot. So the platinum plan costs more out of your paycheck, yes, but that is tax-free money you're paying for your health plan, and your benefits are a lot better. All these dollars are generally after-tax dollars, unless you're using your FSA. So there's our 2 Kaiser plans. Any questions on our Kaiser plans? Just a little plug for the Kaiser smartphone app. Online, there's online registration. If you're with Kaiser, please take a moment to download the app. Make sure you can log into their website. You can talk to doctors. You can refill prescriptions. You can schedule appointments. You can do a lot of things with the online system. So definitely will improve your experience. Also, last plug here for Kaiser. Your Kaiser membership comes with an access to the Calm app. So for any of you looking to establish good habits here in the new year, meditation, mindfulness, these kind of things, the Calm app is fantastic for that stuff. So part of your plan if you're with Kaiser. So let's talk about Cigna. So Cigna plus Oscar. Cigna has been around a very long time. Cigna is a national carrier. It's an international carrier, in fact. But on a national basis, Cigna has been a very big player in the large group market. So companies with 500, 5,000, 50,000 employees, Cigna is a big player in that group. They've never been a big player in the small group, which is employers with less than 100 lives. Here comes Oscar. A few years ago, Oscar tried to become an insurance company specializing in small group. Very much a tech play, very tech forward with everything they did. They realized it's hard to play with the big boys. They partnered with Cigna. So Cigna is the insurance company that is backing up all the claims and has the billions in reserves. And Oscar is the insurance company, and the two of them together are our offer. Cigna, what we're offering is a PPO plan, very, very similar as far as network of coverage as the Aetna plans. So it is totally a PPO plan, and they do a lot of really cool things with the app and a lot of very tech forward type things, virtual urgent care, doctors on demand, that kind of stuff. So if you are enrolling in this, once you get your ID card, I encourage you to download this app, download the Cigna app, log in, register, and start to get to work on using their policy. Down here, this map, this is just the sites in which you can set up a Cigna plan. You have doctors in all 50 states. All right, so it's not like if you're in Idaho, you're out of luck. This is just where an employer can be located to start up a plan. So Just like Aetna, you have a national PPO network that's in every state of the country. So don't get worried about that particular picture there. So here's our 3 PPO plans. Lots of similarities in how they are built to our Aetna plans that we're leaving. The silver plan is going to have your highest deductible. It's going to be the lowest cost out of your pocket, out of your paycheck. All right. So it's going to be the lowest cost PPO. There is a $9,000 or $8,950 out of pocket max. We've got doctor visits for regular and specialists with the deductible waived. But you'll notice that after for lab, x-ray, CAT scans, MRIs, physical therapy, a lot of these are after your deductible. So the silver plan is really great for those of you that aren't using healthcare very much, or maybe you're just using it for doctor visits and generic drugs. If that's the case, this is going to be a super affordable plan. For those of you that have a knee surgery coming up, you're going to have a baby, you get frequent MRIs, I might steer you a little bit away from this plan just because you have to meet that deductible in full before you have access to some of those benefits. So that's kind of the caution with the silver plan. Low cost, higher out of pocket. Then you get into the gold plan. This is kind of the medium porridge of it all, right? $500 deductible, not quite as high, pretty manageable. You still have to pay the co-insurance, the 25%, all these things after your deductible, and your out-of-pocket maximum is $8,700. So you see how those benefits look across the board. And then the platinum plan, lower deductible at $250, but the real benefit is the out-of-pocket max here at $4,750. So that's the most you would pay in a calendar year. So I just want to give a quick example of how these plans kind of work when it gets into real life. So let's say I'm on this gold plan here, and I have a hospital stay. I got to do an overnight for a fill in the blank thing. It's going to be a $25,000 issue. So the way that would work, say I haven't used my plan at all. I go into the hospital, I owe 100% of the cost for the first $500. Boom, $500 I pay. Now there's $24,500 left of that expense. Then you pay 25% of that number. Cigna plus Oscar pays 75% of that number until you hit your $8,700 if you would. So that would be another $6,100. So that particular event would cost you $6,625. So it's a $500 deductible, 25% of the remaining $24,500. That's a little over $6,000. And then that would be what your cost would be. Now, later on, if you had anything else happen, if you needed an MRI, if you needed prescription drugs, whatever it would be, you're getting really close to your maximum out of pocket of $8,700. Once you hit that number, you pay for nothing for the rest of the calendar year. So let's say that was a $100,000 problem and I paid all $8,700. Next week, I go to see a physical therapist. I go get a prescription drug. I have an emergency room visit. You don't pay $1 for any of that for the rest of the calendar year. All right. So for those of you that might have an expensive year this year or the next or one of these years, if you get to that place where you're paying zero, you want to load up on everything you got, refill your prescriptions, make sure you get all those physical therapy visits out of the way, do all the things you need to do, because on January 1st of every year, these numbers reset to zero. Okay, so that's January 1st. Even though we have a February renewal, all health plans renew their deductibles and out-of-pockets. It all starts over on January 1. Any questions about any of these benefits for Cigna plus Oscar? Okay, so I'm going to kind of run through some of this stuff pretty quickly. Cigna plus Oscar's got a really nice free doctor on call type apps 24/7. Very helpful for those of you that might have something that is urgent yet not an emergency. Of course, if you got a bone sticking out of your leg, don't call these people on the app. Go to the emergency room. But for a lot of things, we know what's going on, or we just need some help. We need a prescription called in. They've got a really nice doctor on call feature. Really fun there. Really good benefit there. Finding a doctor. This is going to be a new system to you guys. So the website is hioscar.com. In your enrollment portal, you're going to see links to all of these, to a tutorial on how to find a doctor. So this is going to be a quick little look at it, but you'll be able to access this again once you're in the enrollment portal. Pretty easy navigation. It's going to ask you if you want to just search if you're a guest, or if you're a member. So once you become a member, of course, you want to log in and set yourself up. That way you don't have to choose your network. The system will know what your network is. So 2023, we're employer provided, Cigna plus Oscar, California. So then the network down here would be the Cigna plus Oscar PPO. So you'll work your way through that. This is how it would look once you are able to search for providers. You can search by name of provider, by type of service, all those kind of things, just like most insurance companies. I find the Cigna plus Oscar website to be pretty user friendly. So I think you will too. Again, more information on how this looks when you're searching providers. You can search for prescription drugs as well. You can look for doctors, facilities, or prescription drugs. You're trying to find out how this prescription drug that you're on what would it land in the formulary? Is it tier 1? Is it tier 2? Is it tier 3? You can search for that as well. More information on that. And then this is some extra added value stuff they have. Cigna plus Oscar has a walking tracker through Google Fit or through Apple Health. You get $1 for every day you hit your goal. So for those of you taking a lot of steps, or those of you again wanting to start some good habits, download the app, and you can start making a few bucks for something that either you're already doing, or maybe it's that last little bit of encouragement to get you moving. Here's Cigna plus Oscar's wellness app, Talkspace. So Kaiser has Calm, Cigna plus Oscar has Talkspace. So again, really nice benefit that just comes right along with what you're already paying for. So I'm going to get into dental plans now. Any questions on anything medical we talked about? All right, so dental plan stays the same. We have our PPO dental plan with Guardian. As a reminder, your PPO network is kind of divided into two sections. There's the Alliance network and the Preferred network. The Alliance network is skinnier, not as many dentists in there, but you don't pay as much when you go use it. So you'll see that your deductible for the Alliance network is only $25 versus Preferred is $50. Generally speaking, PPO dental plans have a $50 deductible. So the Preferred is what you usually get. 25 is a little bit lower. And then notice when it gets into basic type care, the Alliance network, it pays 100% versus 80% for the Preferred network. And then for major care, 60% versus 50. So for those of you that want to do a little bit more work, just becoming a little bit more of a consumer, finding an Alliance provider is going to save you some money. We have a $1,500 annual benefit. That's important because it works opposite of how medical plans work. We talked about with medical, once you hit that out-of-pocket maximum, then the insurance company pays everything and you pay nothing. With dental plans, unfortunately, that annual maximum means once you get to that maximum, then they pay nothing else and you pay everything else. All right, so that's your dental maximum. That's a $1,500 a year maximum. And we also have kind of a rollover benefit, which is nice. Rollover threshold, what this means is if you use your dental benefits, but you spend no more than $700, then they'll allow you to roll over as much as $350 to next year. So now you would have an $1,850 maximum the next year. If you are using only in-network providers, they let you roll over as much as $500. And the most that they'll let you roll over total is $1,250. So the most you could have in your maximum benefit with rollovers would be $2,250. All right. So this is, again, a little more detail on those different levels: preventative, basic, major, root canals and periodontal surgery and maintenance. They put all this into basic care, which is kind of the marks of a good dental plan. So that's good. And then your website is guardiananytime.com. The phone number's here. Again, this information is embedded into the enrollment portal, so you have access to this later on, the full PDF. And then here's that rollover program we just talked about. Spend no more than $700. You get to roll over a certain amount, and the most is $1,250. So that's a nice little benefit that can supplement the $1,500 benefit. Here's a little note on the Alliance network versus the preferred network. Again, to find this, you can go to this website here, Guardian Anytime, and you can be looking for Alliance network dentists. They'll be notated when you're looking up the providers. We don't have a vision insurance plan, but we have a discount plan through VSP Vision. So for those of you that need a little, that want some discounts around vision, it's part of the Guardian network plan that we have. So that's a nice little benefit there. And the last couple of benefits to talk about is also from Guardian. We have our life insurance that the company pays for, $25,000 for everybody, and then short-term disability that the company is paying for, which is 60% of your salary to a max of $1,000 a week. Very good. Those are benefits that are just paid for you. And then we have the additional benefits. Now, these would be paid for out of your pocket. So we have a long-term disability benefit that we'll talk about shortly. And then we have flexible spending accounts, which we'll talk about right now. So flexible spending accounts are very, very helpful. If you know you have predictable medical expenses, using an FSA is fantastic. The amount that you can use is $3,050. You can put up to $3,050 into your FSA. You have a rollover feature. So if you put in whatever you put in, it is a use it or lose it type of deal. That's the drawback of an FSA. However, you are allowed to roll over $610. So if you put in 1,000 and used 400, you would still have $600 left over that you could roll over to next year. So that's important. That's an increase of $40 on that rollover. And then dependent care FSA. For those of you with kids in daycare, this is a very, very important benefit to use because it costs more than $5,000 a year to put your kids in daycare. For any of you that have kids and have daycare, I'm painfully aware of that. So really nice benefit to use to pay for those kind of things. Any questions on flexible spending accounts? Okay. So disability, so we have our short-term and our long-term coverage. So the long-term disability benefit it's a little bit wonky because our enrollment portal doesn't really support the way that Guardian does this because the rates are dependent on the ages and your income and all kinds of different stuff you want. So if you're interested in more information on the long-term disability, when you get into the enrollment portal, at the bottom of your overview and profile, where it's going to ask for your name and address and social security number, at the bottom, there's this little question that says, are you interested in more information on long-term disability? If so, you hit this yes button and we'll reach out to you and help you with that. This is what that would look like basically for anybody that was interested in disability. So if I'm 40 to 44 here and I make $80,000 a year, I can have as much as a $4,000 a month benefit, and that would cost me $69.08 per month. All right, so these are all monthly numbers. All right, so that gives you an idea of what you're looking at should you be interested in something like that. If you are, you'll just kind of let us know in this little box here at the bottom of your profile. So a little bit more about Guardian. They have an employee assistance program. This is kind of supplements that Calm app, that Talkspace app, but this is a really nice benefit for any of you that don't know kind of where to start on your mental health journey. You want to talk to someone about marital issues, financial issues, drug or alcohol abuse, whatever might be happening in your life that's private. You want a safe place to go with that. Guardian's got a really nice program that can help you with that. So let's talk about our enrollment. This is the email that you guys just got. It's going to say all these things, and at the very bottom, it's got the little login button. If you've been to this website before, it'll look just like this. You're going to put in your username and your password, and you're off to the races. If you forgot your password, there's a little forgot button right there. If you need extra help logging in, reach out to me and be happy to help you with that. Reset a password. For those of you who've never been in the system, it's going to ask you to set up your password, accept the terms and conditions, and then you'll be into the system. Again, here's that note that at the bottom of that profile page is where you can indicate about long-term disability. Once you get through your profile, you add your dependents, you say I'm with Medicare, I'm not with Medicare, whatever it may be. Now we're into the place where we're choosing our medical plan. Again, if you have been in this before, you're going to see it has pre-selected that you're enrolled or declined. If you've never been in the system before, all of this is going to be gray, and you need to select a check mark in order to, at the next page, be able to see the different policies that are available to you. If you do not put a check mark here, when you get here, there's going to be no select buttons anywhere. There's going to be nothing for you to select, and you'll be very confused. So you need to make sure you select a check mark to say I wish to enroll, or an X to say I wish to waive coverage. We've got a number of different policy coverages available. So let's say you don't need medical because you're on your spouse's medical, but you want dental and disability and life and FSA. Not a problem at all. You can make these elections separate from each other. So you do not have to enroll the same exact way for everything. Same with adding dependents. You can enroll just yourself in medical, but the whole family on dental. Okay. Once you get into here, you'll see your current plan, whatever you would be mapped to, would be pre-selected. If you're on the Kaiser plan, there'll be a big green rectangle around the one you're on, so it should be pretty easy to kind of jam through here. And each one of these blue lines is a hyperlink that will take you right to some very helpful information throughout the entire portal. The dental, disability, all this, you'll see the similar thing. On the right side, you're going to see your per paycheck, semi-monthly, your per paycheck costs after Alp N Rock pays their portion. All right, so this is per paycheck to the penny of what's going to come out of your paycheck. Once you've gone through the whole system, you'll be able to review your enrollment, whatever plans you want. If it's not what you wanted, you'll hit this little edit button and you'll go back to that particular place and you can fix it. Once it's all right, you hit this continue button. You're taken to basically what amounts to DocuSign. Hit the sign form button. You'll type your signature. You'll use your mouse to write your signature. And then you'll hit next, and then it's going to run you through the entire all the applications and just ask you to plug in. Just click and it plugs in your signature throughout the whole thing. Once you've submitted that and you've finished signing, you'll get an email in your inbox that says, thank you, you finished submitting your benefits, you're all done. That once you get that, you can close the system out and thank you very much, no problem. So that is the end of my presentation. We hit a lot of things there, so I will give you guys time. I'll stay on the call if there's some questions that piled up, but the next steps are look for that email from the EASE enrollment portal. We'd like everybody to enroll by January 16th. For those of you that might not have received the email, check your junk and spam folders. Sometimes through this system it goes there. If you don't find it there either, you can let me know, you can let Katrina know, and we'd be happy to help reset your password or get you what you need. So that's it. I'm going to take my first breath over the last 30 minutes here and let me know if any of you guys have any questions. If you have any questions that maybe aren't suitable for this group environment, my information is right there. Feel free to shoot me an email and we can set up we can carve out 15 minutes today, tomorrow, the next day, whatever it may be, to talk about anything that's on your mind one-on-one. But other than that, that's all I have to say. Any questions?
I have a quick question.
Yes.
For the Kaiser, is that where you have to go through them to get your doctor? You can't directly go to the doctor, or is that something else that I'm thinking of?
Yeah, that is, generally speaking, that's exactly how HMOs work, is you have to pick this doctor. You got to go to Dr. Smith, so you could go to the cardiologist, so you can go to the, whatever these other doctors. You always have to start with your primary care doctor. Kaiser is unique in that they don't necessarily require you to pick a primary care physician. You can just kind of go. If you know you like a particular doctor, you can request them see that doctor and schedule that doctor. But you are able to get into Kaiser without having to see the same person first every time. But that generally will be a primary care provider that will need to kind of triage your need and get you to a specialist that's available. So you can't necessarily refer yourself straight to a specialist, but you don't have to pick a particular primary care provider in order, and see that person every time, which HealthNet and Anthem Blue Cross and Blue Shield and Aetna, every insurance company outside of Kaiser that is an HMO makes you do that. But Kaiser gives you a little more flexibility.
Okay, thank you.
All right, so this is the awkward part where we all stare at each other, waiting to know if it's time to get off the call. Yes, we're all done. You guys can, if you don't have any questions, if you're if you're all good, if there's nothing anybody has, you are excused. I will stick around until the last person jumps off. So thank you guys for your time. I appreciate you.
Thank you.
Thank you.
Thank you.
Bye.